Hello friends, you are welcome to another episode of Youth Empowerment Series. My name is Lady Dr. Sheila and this community is called Health Just How. Yes, Health Just How. We just about everything and anything that has got to do with our health, especially things that affect the health of our youth. We discuss topics that impact on our youth positively. We discuss topics that will make our youth better adults when they grow up. So we discuss relevant topics that concern our youth in terms of their health. We discuss mental health. We discuss reproductive health. We discuss relationship choices. We discuss education. We discuss family. We even discuss economic empowerment, because we want our youths to be all-rounded and well-grounded and resilient even as they transit into their adult life. So if you are interested in topics like this, then you are at the right place. You are welcome. Come right in and take a seat. We are happy to have you with us. So since you like what we discuss here, I would encourage you to give it a thumbs up and also share it with all your contacts so that they will also benefit from what we discuss here. Do that before you forget, because by the time you finish watching this video, you might forget and not subscribe or like it. So do that right away before we continue. Thank you. So the last time we talked about causes and risk factors of cervical cancer. Remember, we said January has been slated by WHO for us to use to educate the public on cervical cancer, the same way we did for breast cancer in October. Every January we are supposed to use it to educate the public on cervical cancer. So we are on that journey this January, and we are going to do back-to-back cervical cancer this January. We've already done the first video that we talked about causes and risk factors of cervical cancer. Today, we are going to talk about symptoms of cervical cancer. Then we will have the last video coming in before the month end, where we will tackle preventions of cervical cancer. We want to take it in bits so that we will understand the information and consume the content well and apply it in our lives. So today we are talking about symptoms of cervical cancer. So the early stages of cervical cancer is usually asymptomatic, meaning it usually presents with no symptoms. That is when it is early. One might not know that she is carrying cervical cancer until she goes to do her routine pap smear. So that is why we encourage people that this month, that is for educating the public on cervical cancer. If you are a female aged 30 years and above and you haven't had your pap smear done before, go to a health facility and go and have your pap smear done. It's a procedure that they will carry out to examine your cervix, take some cells from the cervix, send it to the lab for them to examine, and come back with the results to let you know whether your cells are normal or they are undergoing some changes. So this month is for that. We will come and talk about preventions in our next video. So today let's focus on symptoms of cervical cancer. As I earlier on said, the early stages of cervical cancer usually present with no symptoms. It is asymptomatic. So go to the hospital and get screened. As the disease progresses, we have what we call irregular bleeding or intermenstrual bleeding. And this irregular or intermenstrual bleeding is relevant to women in their reproductive stage. When we say women are in their reproductive stage, we're referring to women who are still undergoing childbirth or women who are still menstruating. If you're a woman and you are still seeing your monthly flow, it means you are in the reproductive stage. This symptom is applicable to you. So sometimes cervical cancer will present as intermenstrual bleeding or irregular menstrual bleed, meaning one might have had her menses maybe on the 1st of January, and the person is expecting next menses to come in 28 days. But then in between the 1st and 28 days, the person might have some form of vaginal bleed again, maybe once or twice. If you see things like that, it might be cervical cancer. It might also be an infection. But when you have intermenstrual bleeding, if you have your menses and you are expecting it on a certain date and the date is not due and you see blood again, it's important to go to the hospital. Sometimes it is just some other form of infection or some uterine infection. It can be anything, so go to the hospital. So that is for women in their reproductive stages. Now, women who are menopausal, meaning women who have stopped menstruating, they experience what we call postmenopausal bleeding. Postmenopausal bleeding, meaning they are in their menopause, they are no more menstruating, but all of a sudden they start seeing something that looks like menstruation again. So they start menstruating. Somebody who might have been in menopause for some time will all of a sudden start seeing blood and would think, oh, menstruation has resumed again. No, it might be a problem. So go to the hospital and let the doctors evaluate you. Let them examine you. Let them run some tests on you and reassure you and let you know what exactly you are dealing with. Cervical cancer can also present as contact bleeding. We call it contact bleeding. That is bleeding after sex. So usually during sex or after sex, it is not normal for people to bleed after sex unless the person is a virgin. But if you are not a virgin and you've been having sex and all of a sudden you have sex and you bleed, that is a sign that is not normal. It can be anything. Just go to the hospital and report, and further evaluation will be done on you. So that is it about contact bleeding or bleeding after sex. Cervical cancer may also present as copious vaginal discharge that does not smell good. So we call it offensive copious vaginal discharge. So usually we all have some form of vaginal discharge, but then it becomes abnormal when this vaginal discharge becomes more and then also tend to have bad odor. It is not normal. It can be anything, can be other sexually transmitted infection, and it can also be cervical cancer. But what we are saying is that when you see some of these abnormalities, go to the hospital, report sick, and have yourself evaluated. Women can also present with pain or discomfort in the vagina. Under normal circumstance, we walk around not feeling any pain or discomfort in the vagina. But when you begin to feel some pain or discomfort in the vagina, try and report to the hospital or health facility close by you for further evaluation. There may also be pain in the pelvic area or at the back of the legs, and this usually happens when the disease has advanced or when it's advancing. It may signify cancer cells that have spread to those areas, causing pain at the pelvic region and also behind the legs. One may also present with leg swelling, and usually this leg swelling is unilateral. We call it unilateral. It means it just happens to one leg. It's not both legs that are swollen, and this may also be as a result of spread of cancer cells blocking some of the lymph nodes that are in that region, preventing lymph flow, and this may lead to swelling of one of the legs. People with cervical cancer, just like a lot of chronic illnesses, may lose appetite. They might not eat well, and so they will lose weight. So you have people that's in the advanced stage tend to lose appetite, and they will lose weight, and also they will become weak. These are people who are not eating because they have lost appetite, and so they become weak, and they lose all the energy and weight they have. These are the symptoms of cervical cancer that people will usually present with. We have said that during the early stage, it might be asymptomatic. It might not have any symptoms. So if you're above 30 years, make sure you are doing your regular pap smear as you will be told to do. It is usually done between 3 to 5 years. Your doctor may advise you to do your next pap smear in 3 years or even in 5 years. So get your shadow pap smear done if you haven't done some before and you are above 30 years. Thank you. So we are at that stage that we want to take our question of the day. We have said that we want this series this time to be interactive, and we want to learn at the same time. Great. So we want to know whether you have come across anyone with cervical cancer before. Have you come across anyone with cervical cancer? If yes, what were some of the symptoms that the person presented with? So this one is straightforward. We want to know. It gives us an idea. We know the burden of the disease is huge in Africa. In fact, we said in our last video that it is the second most prevalent cancer among women, second to breast cancer. Breast cancer is the first, it's the most prevalent cancer amongst women worldwide. But when it comes to Africa, cervical cancer is the second most prevalent cancer among women. Also because the most important risk factor, that is the human papilloma virus. We talked about that in our previous video where we talked about causes. Please, if you haven't watched it, go and watch. The most important risk factor that causes cervical cancer, that is the human papilloma virus, causes about 99% of all cervical cancer cases in Africa. And most African countries haven't yet started the vaccination against cervical cancer. Thankfully, Ghana has initiated the vaccination against human papilloma virus, the HPV virus. It was initiated in October, and we are grateful to our policymakers and government for getting it started for us. We're going to talk more about that in our next video that will be tackling prevention. So let me leave that. Kindly participate and let's have an interactive community where we gist and learn at the same time. Right. So all too soon we have come to the end of another episode of Youth Empowerment Series. If you like what we do here, kindly subscribe to this channel. Give a thumbs up to this video and share it with all your contacts. Don't just share it with them, encourage them to subscribe to the channel. Share the video on your WhatsApp groups. Share it on your social media groups. Share it on your social media pages, and let's all learn and help this community to grow. This is Health Gist Hub. Thank you for staying with me. See you soon in my next video. Bye bye.